Welcome back to the Morning Blend. This year, about 300,000 people will have surgery to augment their breasts. It is the most common plastic surgery procedure in the United States, topping even nose jobs and tummy tucks. So today, what you need to know if you're considering it.
That's right. Dr. Alex Colque is a board-certified plastic surgeon. He's here with more on breast augmentations and other procedures that are great options during the summer. Good to have you here.
Oh, thank you.
Nice to see you.
Do you see that people tend to think about breast augmentation surgery this time of year because they're wearing more revealing clothes or swimsuits?
Well, they do. I think that with more revealing clothes and obviously swimsuits and bikinis, patients start to recognize and see their breast size and different things that they'll want improved about that. Be it more volume or an improved shape, more cleavage, more upper pole fullness. Those are the most common requests that we see in patients that come to look for breast enhancement procedures.
How do you evaluate it and kind of consult with somebody if they come in and they want to make changes, and also in setting expectations about size and things like that and what's appropriate?
Right. So each patient's different, and we start off by listening to what the patient wants. Some patients want to go, just up a cup size or two, and some patients want to go a little bit larger than that, depending on what their needs are. And then, as part of our consultation process, they will do measurements and use a lot of the patient's body frame to make sure that the enhancement that they're receiving or the size of the implant that they're going to choose will also fit their body. And make sure that fits them. And most commonly, the patients in my practice will want a breast enhancement, but still stay proportioned to their body.
Well, and a lot of people do like corrections or lifts as well, right? Because a couple of my friends who've had the surgery, they had uneven breasts, and they wanted to just make them more even. Right. One was smaller, one was larger, and they were always insecure about that or padding on one side.
Right. It's actually very common to have asymmetric breasts, probably more common than having perfectly symmetric breasts, and we see that very, very frequently. And when we do see that, we treat that in a couple different ways. Sometimes we lift one side or sometimes lift both sides, but kind of adjust for that asymmetry. Sometimes we use two different size implants. That's also a possibility. But patients that need lifts, it's common after patients that have had pregnancy and their breast has undergone some changes, or with weight loss, be it a weight loss procedure or weight loss on their own. We'll oftentimes leave patients with some sagging or drooping to their breasts that require not only volume but also lifting.
Just want them a little perkier.
A little perkier. That's
Yeah.
right. That's right.
Can you still have a mammogram if you've had breast augmentation surgery?
You absolutely can, and that's a very common question that we are asked. It's very common to perform mammograms in patients that have had breast augmentation surgery. Just about every place that does mammograms will see them every day. Because breast augmentation surgery is so common, they have different techniques that they use during the mammogram to perform the mammogram and also protect the implant. So.
And same with breastfeeding, right? You can still breastfeed.
You can still breastfeed after having breast augmentation. There are no restrictions from that.
I know you've got a before and after so that people can see, the difference of someone who had the surgery. Here's the, what is it, just the after? Oh, here's the after.
This is an image of a patient that I performed breast augmentation surgery on with breast implants, who was happy enough to share this photo with us, and you can see just kind of the enhancement that she has had, not only from her breast, but kind of her self-confidence to wear different things that she wasn't comfortable wearing before, and I guess doing photo shoots that she wasn't comfortable doing
but not
before.
too big and not too small. I mean, it's
right.
it's a very proportionate size to her body, as you said, that a lot of women are just looking to have a little bit more volume, a little more sex appeal.
And that's our most common patient that we will see, is one that wants a natural appearing result that fits their body and just gives them the fullness, particularly in the upper pole that they want.
What are some of the other options or procedures that you're doing that maybe specifically during summer are great for people to consider?
Well, during the summertime, there are some patients that will use the summertime for recovery if they have a break in their job or different activities that will have more major procedures. But cool sculpting is always very common during the summertime because there's no downtime, there's no incisions, there's no restrictions on swimming or any of those activities. So very common to perform that during the summertime.
And what's that used for?
It's spot body fat reduction, so it reduces body fat in specific areas where the applicator is placed by freezing the fat, and after that the fat is frozen and the body removes it by its own metabolic process.
And it doesn't come back.
And it doesn't come back.
You're getting rid of the actual fat cell, right?
You're getting rid of the cells, and the cells, when they're gone, they're gone forever.
That is wonderful. And where can you have cool sculpting done? It's midsection, obviously.
That's the most common area, midsection, but also thighs have been becoming more common. There's a new applicator out that allows us to treat more different areas, including the inner and outer thighs with some of the new cool sculpting applicators. And there are just always more advancements in that to treat more different areas.
Wonderful.
Yeah. You're doing basically an open house for Alex Colque. You can go and meet him. It's breast augmentation and summer treatment options. You can go in next Thursday, that's the 25th, from 6 to 8 p.m. to learn more. And right now, the first guest to reserve a spot will receive, sorry, the first 10 guests, did I not say the number? First 10 guests to reserve a spot will receive an additional $150 oxygen facial. There you go. First 10 who call. Here's the number, 262-781-9000, to learn more from Skiin. Thanks for being here, Doctor.
Oh, thank you guys very much.
Great to see you.
Next
Appreciate
Thursday, we'll talk all about breast enhancement. Happy to see anyone there.
That's
Learn more.
wonderful. For 2 hours you're doing that. Thank you so much.
Yeah.